Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Yesterday, it was announced that Malaysia had reached the target of fully vaccinating 80% of our adult population, and therefore movement restrictions will soon be gradually lifted. But what does this 80% milestone signify, and how will it change the way we evaluate risk? Tonight, we ask two public health experts how they view this benchmark. Our first guest tonight is Associate Professor Dr. Farhan Rusli. He's a public health medicine specialist at International Islamic University Malaysia. He's also the director of the Selangor Task Force Operations. Farhan, welcome to the show. It's good to have you back. Let's take a look at this. This 80% number, fully vaccinating 80% of the adult population, that's such welcomed news. But maybe you can help us better understand what this number represents. I mean, what is the science behind this 80% target?
Well, I think, before we go any further into this 80%, we should start asking ourselves, what is this 80% based on? What is the denominator that's being used? And I think it's time that we all understood that it's based on the 2010 census, which means that we do not know the exact number of what it is. So that's why for me, when you say it is 80% of the adult population, it is 80% of what adult population? Is it only Malaysians registered to a certain number using the 0.4% average growth per year for you to get that number? Because have you factored in all the illegal immigrants, all the people without documents into this adult population? Because they do make up a large chunk of the adult population. So for me, when you say 80%, I don't pay too much attention to it, because in my mind, it's closer to about 65 or 70. And I think this is something that we must understand, that when you get your initial denominator to not be as accurate as possible, you should not be using arbitrary numbers such as 80% to show that you have achieved a certain target, knowing well that this number is quite meaningless.
Yeah, Varun, could you help us? And I know that this question of the denominator, and also the fact that this denominator, the total number of vaccinated people, including foreign workers, is added to it, and even if they're not added to the denominator itself. But I do want to ask you if this is meaningful from the perspective of infectious disease, how it progresses, how it's transmitted. Does 80% represent a code for herd immunity? I know we were told not to think in terms of herd immunity, but is that what is implicit in the 80% number that the government has used?
Well, I think it's just a number to give people a more calming reassurance that there is something that's moving on with the country. I have never ever heard anyone using the term of 80% of an adult population to be immunized, as though that the virus does not actually affect all the other people who are in the population, such as the small children who are not part of this 80% equation. I think a more realistic number is to see what is the total percentage of the entire population, including the immigrants and the illegal immigrants. How many percent of this population are actually vaccinated? So if that number is about 55 to 60%, which means that you still have a 40% gap of people who are yet to be vaccinated. And these people, knowingly, you know that even with the 60% who are vaccinated, can still transmit the disease and still give the disease to others. And if you have close to 40% people who are still unvaccinated, they may still actually fill up your hospital beds and actually break your healthcare system. And you can see this happening in the northern regions. And even yesterday, when you had 1,100 plus people in category 5s, 960 people actually in the ICU needing ventilators. So these are actually numbers which are the numbers that you should be targeting to bring down. So even if the government is reporting 70%, 80%, 90%, at the same time, you are actually still reporting the high number of people needing ventilators with the high number of deaths and also BIDs, which does not reflect that you're actually doing better, but you're actually showing that you're actually at the same place where we were 3 months ago.
Dr. Farhan, so the fact that we are opening up, we're lifting restrictions, we're on the cusp of allowing interstate travel, is that too soon in your opinion?
Well, in my opinion, interstate travel has never been the factor of spreading diseases. I mean, last time it was what, 1.8% of people who were detected to have this sort of clusters due to movements. And we've seen that actually the movement itself does not cause the transmission of disease, but rather the congregation of people in certain areas. Now, if we can actually open up and lift the borders, because I am totally against actually locking down any part of the state because it doesn't actually help. If you open these places up, but yet you implement a sort of a green pass so that if you travel from KL back to Pahang, but for you to eat in a restaurant in Pahang, you would need to be fully vaccinated. If you don't, you cannot go inside. You cannot go inside the mosque. You cannot go inside the shopping mall, which means that you do not get yourself to expose other people because you're unvaccinated. You may only perhaps be allowed to enter your family home because that's the only place that actually will allow you in without getting fully vaccinated. Even hotels don't allow you in. So in this way, you actually limit the people to have access to all the places that can actually be potential areas of spread, rather than saying that if you cross the boundary or the state lines, you will definitely give the disease somewhere else. It doesn't work that way. It's actually always crowded areas and congregative areas that actually causes spread of the disease. And this is the way that we should be doing things so that we can actually live with COVID in the safe manner possible.
And I want to come back to those numbers again, which have to do with kind of a national a portrait of what is going on. But when you look at the breakdown in terms of states, we know that there are some states in the Federation with very low vaccination levels. And so does that make a difference when, in fact, this 80% is not evenly distributed across the country?
Well, number one, sure, I think it's a very good question. Number one, I think the phases itself, phase 1, phase 2, phase 3, phase 4 of the National Recovery Plan, I think that's absolutely bollocks because it doesn't make sense for you to have a kind of fixed phases moving into one single timeline, yet knowing that the virus or the pandemic itself is actually very dynamic, which means that cases may surge, cases may drop. So you see that the troubled states are those who are actually in phase 2 and 3. When Selangor was in phase 1, prior to moving into phase 2, we actually had the highest number of vaccinations, and we actually had more leniency in a phase 1 state, whereby we could actually allow dine-ins because the workers were fully vaccinated, compared to states who were in phase 2 or 3 because their workers were yet to be vaccinated. So when you look at this, it shows that the numbers itself must not be looked at it and be placed as though that is your golden standard for you to move forward, because it doesn't give you that sense of realistic picture. It rather just gives you a sense of fallacy, that 80% is a fallacy to make you believe that the situation is improving, to make you believe that we are getting better, when if you look at the granular numbers, it is in fact actually not.
Okay, so let's talk about those granular numbers. Farhan, I mean, how do we make sense of the numbers that have been presented by the Ministry of Health? You know, the data on deaths, on ICU occupancy, on ventilator use. What are you watching, or what are the numbers telling you about the trajectory and the trend of this pandemic here in Malaysia still?
Well, let me start by saying the numbers that I don't watch. I don't look at the number of cases per day because it's absolutely rubbish for you to look at that. We can get to that later if you would like to know why. Number two, I look at the number of cases in the ICU. I look at the number of cases that need ventilation. I look at the numbers of people who are in these two categories. Were they vaccinated or were they unvaccinated? If they were vaccinated, what were the vaccines that were given to them? Because this gives us a bigger picture on what we should be preparing for. Number three, we have to look at the number of deaths. And out of this number of deaths, how many were actually BIDs? And what caused these BIDs? Whether these people were actually vaccinated or unvaccinated. Why are these things important? Because you see, COVID is a trend. It looks as though that we see a high surge, especially during the months of December up to March. If you look at the trend last year, we are in the same place where we were last year prior to the summer elections happening. We were actually happy being in this phase right now. And then towards November, December, when winter months started and we see a change in the climate, we see a surge in the spike. Right now, we have to be prepared. What are we going to do when there is a surge and there is a spike in the number of cases? Or what are we going to be planning when there is new variants coming in? So these numbers are extremely important because now you have to start developing an algorithm if you were to give booster doses and all these things, who should you be giving it to? To which groups, to which populations, to which people who actually got what type of vaccines in the first and second dose? So it all plays a role, and it's actually all interlinked and interwebbed for you to actually move out of this pandemic, or actually to live with COVID in the safest manner possible.
Farhan, over the last couple of months, we've been talking about the pandemic and the information that's necessary for experts like yourself and others to make assessments and hopefully for policies to be driven by that data. Are you getting all the data that you need, or is it still being hoarded by the Ministry of Health and other stakeholders who have, in the past at least, guarded this data rather jealously?
Well, I think, number one, let's make things clear, right? When with the new health minister, it's a bit more aggressive in the way he's more open to ideas, and he's actually saying that, look, let's get things done and let's get it done as fast as possible. So from there, you can see a very stark and a very big improvement. I think because the bar that he's actually benchmarking to was quite low from the previous one. So in this sense, you can see that there is open data sharing, but when cases such as the number of deaths is not reflective, because this is the number of backlogs for the past 6 weeks. It is troubling, because now you start thinking 1.5 years, close to 2 years, we are moving down this line. Are we still not getting the data information as quickly as possible? How can we actually be clear and sure that the number of things that are being reported is actually accurate and real-time data? Because this is extremely important, because that data is what is the onus that you use to actually have your next step of action and plan. And if that data is useless because it's backlogs, how can you actually plan properly for your next steps moving forward?
Right, okay, so in the couple of minutes that we have left, I just want to come back to something you said a bit earlier about not caring about the daily case numbers. Could you come back and explain why you said that?
Well, number one, we have to understand that the numbers that are reported is being absolute numbers. It's a more better approach is actually reporting it based on percentage of populations or rate of infections. Right now, that number is close to 18 to 20% positivity rate. However, do you know how many number of saliva test kits actually have been given out that is actually negative? So you report a lot of positive cases, yet there is a big chunk of the population who actually get themselves swabbed and tested, such as you, Sharad and Mel. I'm sure you've done the saliva test kits. And if it's negative, are you sure that you report each and every single test that's being done? Because that is what is actually needed, so that your denominator actually reflects how many tests are being done and conducted, and out of those, how many is actually positive. If we keep going down this path, even if our numbers are 10,000 or 9,000 cases reported a day, our positivity rate will keep on increasing, because we are only reporting number of cases that are detected to be positive, and we are actually ignoring a lot of this negative tests that is actually occurring, and it is yet to be reported. And that is why, for me, I never look at the arbitrary number of how many positive cases are there in a day.
Farhan, very quickly, what would you like to see happen in the near future in terms of policy, especially as we kind of move into this phase of opening up?
Well, we need to do three things. Number one, we need to have in place a national testing strategy last month. We are already months late of a national testing strategy that deals and details exactly what's about to happen, what are the things that we're going to do, and how we're going to do it. Number two, we should have a pandemic planning response, so that in the future, when we have spikes and outbreaks, everybody knows what to do, exactly how to do it. So in this way, we can be as prepared as ever. And number three, we should actually be more open, in the sense whereby the Ministry of Health now has the opportunity to actually allow in experts from other sectors of the country to help them build in this pandemic response plan. These three things, if the Ministry of Health can get it done, and if he can get it done fast, I'm sure that it will be a lasting legacy for him.
All right, always brilliant talking to you. Thank you so much for your time. That was Public Health Medicine Specialist, Dr. Farhan Rusli. We're going to take a quick break and we will be back with more. Stay tuned to consider this.
Adakah penyelesaian rangkaian awan dapat
Ayuh keluarga Malaysia,
Kita bulatkan tekad dan bersatu hati untuk terus memelihara serta mempertahankan kedaulatan negara. Sebagai keluarga Malaysia yang besar, kita harus bertoleransi dalam semua perkara. Hormat menghormati serta mengekalkan perpaduan rakyat yang berbilang kaum, agama dan bangsa serta integrasi nasional silang budaya adalah tunjang kekuatan kita sebagai sebuah negara bangsa yang berjaya. Umpama selembar benang dikait, ditenun dan dijalin, akhirnya menjadi kain yang sempurna indah.
Shaken up, now is the opportunity to reassess what works and what doesn't work for Malaysia.
Authorities can take action against workers who refuse COVID-19 vaccination under the Occupational Safety and Health Act 1994.
Thank you so much for staying with Shrad and I on Consider This. Let's continue our discussion about the announcement that was made yesterday that Malaysia had reached the target of fully vaccinating 80% of its adult population. But what does that milestone actually mean? Joining us on the show tonight, we have University of Malaya's infectious diseases consultant, Dr. Sharifah Farida Said Omar. She's also the head of the Infectious Diseases Unit at Medical Centre and the co-chair of the vaccination program at the UMMC's special PPV. Dr. Sharifah, a pleasure to have you on the show. Thank you so much for joining us tonight. The success of the immunization program cannot be denied. So many people have worked so hard to get us here, but I'm wondering what that 80% of the adult population in Malaysia that's fully vaccinated, what does that look like? How does that translate for our health system? How are you seeing this translate into what's happening in hospitals?
Okay. Thank you so much, Melissa Sharad, for having me on tonight. So, I'm not an epidemiologist, so in terms of numbers, I'm not very good with that. What is your target? But I think generally, when we started off the vaccination program, with any infectious diseases, we talk about herd immunity. So in terms of the rate of transmission that we were looking at, we thought that 80% of the population adult population must be vaccinated before we could sort of safely open up and hope that the transmission of disease can be reduced by reaching this 80% vaccination population. But I think it's still a very important number, even though we've heard about, in recent months, people talking about there's no more, herd immunity is no longer relevant. But I do feel that there is some significance to it, because it's sort of given us like a benchmark or like a target to reach, so that we can drive this vaccination program. And even if we, exceed the 80%, that will be even greater news. So, having reached that first milestone of 80%, I think it's a huge achievement. Obviously, as the disease evolved and we see, the new variants coming out, transmission is more than the wild type of the virus. Maybe we do need to go beyond 80% for us to be able to contain this disease even more.
Yeah, Sharifa, I wonder if we can look at that key term there, adult, because there are, critics who are saying that the disease does not, in fact, discriminate between different cohorts in the population, young people as likely to get infected, maybe not develop a severe disease as it expresses itself. But for you, how do you make that distinction between the adult and younger people in the population, especially as we now are considering vaccinations for them, and we need to figure out, who among them should get it, and who would be the priority groups?
So when we started off the vaccination program, there were a lot of factors to consider. So you're thinking about what is the purpose of vaccination? One is obviously to control the disease, stopping people from getting infected. And then you're looking at stopping people from getting severe disease and dying from the disease. So having to juggle all these priorities was quite a task, I think, for the government, for the Jawatan Kuasa JKJ, AV, and so on, to decide who should be vaccinated. Initially, the target was, reach herd immunity so that we can stop the transmission and therefore hope to be rid of COVID-19. But after a while, I think it was quite obvious that, it's not a disease that's going to go away overnight just by stopping the transmission, because transmission was quite extensive with COVID-19, the way it transmitted, the fact that we found out that even asymptomatic patients can transmit the disease. So controlling the disease just by stopping the transmission was not enough. So other priorities had to be looked into, and by that time we were seeing more and more people dying of the disease, getting hospitalized with disease. So it was putting a burden on the healthcare system as well. So that's why I think the first priority for vaccination in our country was for healthcare workers, followed by the elderly, because that's where the burden of the disease was, putting a burden on our healthcare system. So we probably couldn't tackle the rate of transmission very much, but I think it was important to tackle the main burden, which was on hospitalization and severe disease at the beginning. Now, as we move on and more people are being vaccinated, people who are vulnerable to severe disease, to hospitalization, to death, were mostly vaccinated. So strategies had to be changed. We were seeing more and more transmission with the Delta variant. And it means that, previously at the beginning of the transmission, we didn't see that much children being infected. We are seeing more and more of that now. So therefore, children also became a vector of transmission, if you like. So it was no longer, we couldn't ignore the fact that children had to be vaccinated too, even though most of them, if they do get infected, they don't get severe disease, but they were also another agent of transmission. So I think, things change as you go along. You learn more things about the disease, you learn more things about COVID, and you apply as much of the knowledge that you have into trying to control the disease and trying to get back to normal.
Right. Can I just stay on this topic of vaccinating children? I'm just wondering whether the physiology of children is the same, or is it different from adults in terms of antibody production? So when you're taking a vaccine and you're thinking about giving it to teenagers, is that different from, say, an adult, or different from, say, an under 12? And how do you demarcate those differences?
I'm not a pediatrician, but yes, there will be some differences. I think adolescents are probably a little bit closer to adults. Therefore, even when we vaccinate those above 12, the dose that we give is fairly similar. But I think studies just came out, I think past couple of days, showing that vaccinating those who are much younger, you don't need as much vaccine, or the dose of the vaccine can be reduced. But they still mounted a good vaccine response. Even in those who were, the first studies that came out in adolescents between 12 to 16 years old, they did show a robust immune response to the vaccination. So, younger people, more robust immune system. So, does that mean that they're more protected? we don't know. But what we do know, does it mean that the immunity that they get from vaccination will last longer? We don't know. So these are all being studied. So there are some differences, I think, between the different age groups in terms of the disease itself, COVID-19, and also the response to vaccination.
Yeah, on that score, let's talk about the elderly, the vulnerable, people with comorbidities, and perhaps the waning effectivity of some of the vaccines that have been, used in inoculating the population. What is your position on that booster, the third shot, and how should we think about it? Is it a question of what vaccine you got, because some vaccines are performing better than others, or is it just your health status that is the most important thing?
So yeah, this is another thing that's come up quite a lot in this recent weeks, booster versus and also additional dosing. So we studies have been carried out to see whether the immune response that you get with vaccination, how long do they last for? And there's evidence that, there's many ways to measure your immune system. So there's the antibodies, there's the other pathway of immunity, which some tests can some commercial tests are able to do it, some are not able to do it. And what these results actually mean is also different. From a different perspective. For example, you look at the antibody levels. Nobody knows what is an acceptable antibody levels. When do you say that this level is too low? And then at the same time, even though your antibodies are not there, your memory cells might be there, and so on. So there's a lot of things to think about when you talk about immune response. On top of that, immune response, does that equate to, more disease in the future? Does it mean that when your immune level is at this level, you are more vulnerable to getting the disease, you're more vulnerable to getting more severe disease, and so on? We still don't know that because it's still very early on. I think most of the studies just tell us that the immune response seems to be waning off after a certain time. It wanes off more quickly in those who are elderly, who are, many months after they've completed the dosage. And the initial response is also not as robust, I suppose, in some population like the elderly.
Yeah.
And
sorry to interrupt, Sharifah. Very quickly, can I ask you, then should the policy be that that it should be based on the individual, their health status, their discussions with their primary healthcare provider, rather than having a kind of national template for deciding who gets the booster and when?
I think there should still be a national template, because if you start to get your vulnerable population getting more disease, hospitalization, and so on, then you're just going to put the burden again on the healthcare system, right? So it's not an individual thing. So I think for the additional dose, for those who did not mount a good response to begin with, and these are the elderly immunosuppressed people, these are the ones that probably, that's why it's also prioritized to give them that third shot. But for a booster dose, a third dose for people who have had their vaccines more than 6 months ago in the general population, I don't think that's a priority at the moment, and that can wait.
Right. Thank you so much, Dr. Sharifah, for joining us on the show tonight and giving very clear answers. That was Dr. Sharifah Farida Said Omar of the Medical Center, wrapping up this episode of Consider This. But before we leave you, a reminder that you can always get the latest information on COVID-19 vaccines at astroawani.com, as well as our Astro Awani app. Thank you so much for watching the show. I'm Melissa Idris.
And I'm Sharad Kuttan, signing off for the evening.
See you same time tomorrow. Thank you so much. Good night.